Okay, great. Looks like we have more than 30 participants already. So let's get started. Hello, everyone, and thanks for joining us this morning or this afternoon, depending on where you are. I'd like to welcome you all to our second session on talking interoperability. My name is Melis Güven. I'm with the Social Protection and Jobs Group of the World Bank, and I have the pleasure of setting the context for this exciting event this morning. This event is a part of a dialogue series where each session focuses on one country example, and the dialogue series is organized by the Digital Convergence Initiative, and I'll talk to you more about that in a little bit. Next slide, please. Next. So before I talk about this initiative, though, let's look at the agenda for today. So what are we going to cover during this event? Following these introductory remarks, we will move to our guest speaker. Today's presentation will be an excellent opportunity to hear about the experience of the Belgian Crossroads Bank for Social Security, the CBSS, which has achieved interoperability across a number of social sectors in Belgium. A very interesting case indeed. And this presentation will be followed by a panel discussion, after which we will open the floor for questions from the audience to allow for an exchange. And this is consistent with the name of the series. Remember, this is a dialogue series, and we would most certainly like to promote that dialogue. We have 2 hours for our session, and we will wrap up with some closing remarks, highlighting main points from the discussion at the end of the event. Next slide, please. So some housekeeping rules, which are critical in this virtual world, of course, but also we are all familiar by now. Just to very quickly go over those. For our panelists, we will like to ask you to put your camera on when you're talking. That's of course if you can and if the technology allows, and when you're not talking, please remember to put yourself on mute. Again, for our panelists, if you have a question or would like to make a contribution, kindly raise your virtual hand or type in the chat box. And for the participants, you can type your question in the Q&A box. An important point I'd like to highlight is that this session will be recorded. And we think this is important for future reference, but we also think it's our responsibility to let you know about this. So we are highlighting it here. Next slide. Now, just to provide you with some background on this dialogue series before we move to the actual presentation. The Digital Convergence Initiative is a joint effort under Universal Social Protection 2030, the USB 2030 in short. And while this dialogue series is organized by USB 2030 members, the objective is to be more inclusive by going beyond USB 2030 members to also include representatives of governments, development partners, and private sector towards creating a harmonized and interoperable digital ecosystem for social protection. So as you know, social protection relies on a number of digital solutions, from ID systems to social registries to payment systems and others. And there have been quite a lot of initiatives to develop digital solutions to support implementation of social protection in the recent years. And these initiatives have been accelerated during COVID-19 as the pandemic highlighted the importance of such digital-based systems in responding to the crisis as well, for shock responsiveness. And there are other emerging crises on the horizon, which will also put social protection systems to test, with increasing food and fuel prices and refugee crisis, and of course the enormous challenge of climate change, and all of which are very relevant for social protection, particularly for adaptive social protection. So it's really important that social protection systems are supported by robust delivery systems leveraging technology. And it is possible to present better and integrated solutions to countries if these global digital initiatives that I mentioned before can be interoperable and can be presented to countries as a package of solutions depending on their needs. So the purpose of the Digital Convergence Initiative is to promote building consensus around standards with the objective to achieve interoperability. This would then allow to develop solutions that are interoperable, easy to use, easy to integrate, maintain, and scale based on globally agreed standards and guidelines. This would then allow to reduce time and costs of developing solutions at the country and at the program level. And it would also give flexibility to countries to mix and match different components of different initiatives or develop in-house solutions based on these standards. These standards would also allow to ensure that systems are future-proof by design. So they can be upgraded as they become obsolete and as maintenance becomes increasingly costly. Next slide, please. So this dialogue series is planned as a monthly series, and the objective is to facilitate in-depth technical conversations. Mainly, this series is an opportunity to talk about the nuts and bolts of country experiences. Specifically, we would like to promote learning and knowledge exchange on how countries design their social protection information systems for interoperability, and what were the challenges that they faced along the way and how these challenges were addressed. So we see this dialogue series as an excellent opportunity to learn about country experiences globally. Next, please. So now it's time to introduce our panel. Next, please. So we are very happy to have this excellent panel join us today. Our speaker today is Frank Robben. He is the General Manager of the CBSS and the e-health platform. We have two discussants with us today who will share their reflections on Frank's presentation, Ernesto Brodezon and Anita Mittal, and Valentina Barca will serve as the moderator for the event to facilitate the discussion. Next, please. So let me provide you more details about our panelists. I will start with Frank. Frank Robben, who he's a Belgian computer scientist, lawyer, civil servant, and a lecturer. And since 1985, he has been the driving force behind administrative simplification, process optimization, and computerization in the Belgian social, healthcare, and public sector. And since 1991, Frank is the general manager of the Crossroads Bank for Social Security, an institution that he founded. And we will hear about the CBSS from him directly in a little bit. Next slide, please. Moving to Ernesto. Ernesto Brodezon started his career as a consultant for large technology consulting firms. And then between 2003 and 2016, he worked as a senior official at the Mexican government, coordinating social security institutions and leveraging technology to improve service delivery and processes with a focus on individuals. And currently, he is a senior official in charge of coordinating the ICT Technical Commission, as well as Management and Innovation Technical Commissions. Next, please. And Anita Mittal leads this Digital Convergence Initiative. She has extensive experience in design and implementation of identification systems for the World Bank client countries and e-governance standards and frameworks for the government of India. Next, please. And last but not least, Valentina Barca is a social protection expert with a focus on how delivery systems can facilitate the responsiveness, inclusiveness, and effectiveness of social protection systems. In the recent years, she has worked extensively on integrated information systems, shock responsiveness, digital identity, voice and accountability mechanisms, and user-focused M&E systems in the area of social protection, including research, policy design, and implementation work in Asia, Africa, and Latin America across more than 15 countries. So without further ado, I'd like to hand over to Valentina to facilitate discussion. And thanks everyone again for joining us today. And over to you, Valentina.
Thank you so much, Melis, for giving us that overview and for introducing all of our panelists. And I don't want to really take any more space from Frank. We're very keen to get deep into the discussion. What I wanted to say is that as a community, kind of those of us working on this, we're very much aware of the potential benefits of these systems. And we're quite excited today as we get to almost take a look into the future. Very often we focus on low and middle income countries, and today we get to take a look at a high income country, Belgium, and what the Crossroads Bank for Social Security has achieved interoperability across over 3,000 social sector actors. And what's really interesting is the outcomes of this process, some of the most notable achievements being the push system, so the automation, for example, of the granting of benefits and quite proactive processes for addressing issues of non-take-up, for example, beyond the standard efficiency gains that we usually look at. And also really interesting is that the journey that Belgium has taken over time and how this journey is not just a digital journey, but also one that encompasses changes in governance and legal framings. And I'm sure Frank will go quite deep into some of these issues. So a last reminder for the audience, you can start adding your questions as Frank is speaking, and we'll come back to these at the end. So without any further ado, Frank, I'm handing over to you. Thanks.
Okay. You see my screen?
Yes.
Yes. Okay. So thank you for the opportunity to explain it. We have much too many slides, but I will give you an overview, and you can read the other ones if you want to get more information. So I will start. So we started the Crossroads Bank, as it was already said, more than 30 years ago. And we started from two basic questions. What do socially insured people, employers, and policymakers expect, and how can we use ICT to meet these expectations? So, of course, they want an effective social protection, that those who need the benefits get the benefits, that there is fraud prevention, that there is a correct policy support, that as much as possible benefits are granted automatically without people having to ask for all benefits in a happy flow, what we call it. So the people give information once, and we use it, reuse it to calculate and grant the benefits, without a digital divide, so that the system is accessible and that the benefits are available to everyone, even the people that don't have profound knowledge of ICT. That there is an integrated service delivery across institutions, that the organization in the back end, as it was already said, we have about 3,000 institutions in Belgium that are working on several aspects of social protection, but people want an integrated service across these institutions, across the government levels. They want services that are delivered at the occasion of key life events, when a child is born, when they get unemployed, when they get sick, when they are retiring, and so on. So an integrated service delivered at the occasion of key life events, with a minimal administrative burden and minimal cost, with self-service possibilities, so that they can follow the evolution of the decision making process. No wrong door. So they want to get access to the system via the channels that they choose. It can be an electronic channel, it can be a paper channel, it can be a direct contact, it can be a smartphone, a tablet, a PC, and with fair competition and legal certainty on their benefits and the contributions that have to be paid. So this is a quick overview of what we try to have, and the expectations we try to meet. So the second question is then, how do you do it? How can we use ICT as an enabler to meet those expectations? And I cannot explain everything, but I will stress on a number of topics. So first important thing is to have a common vision and to have cooperation between all those institutions, common vision on how we process data, how we exchange data, and how we take the necessary measures in the area of security and privacy protection. With an only once collection of factual data, that's what I told you already, asking only once information from people, from citizens, from employers, and reuse it to deliver integrated services. So multifunctional reuse of data. That means that you have to collect factual data that you can use for the calculation of the several benefits. When we started 30 years ago, we had about 800 paper documents. Today we have 200 electronic processes between those institutions. So it is important not to consolidate bad practices, but to do business process re-engineering before you automate the system. Based on authentic sources, so databases with reliable information, where those who need the information can get the information, and data sharing according to interoperability standards not only on the technical level, but also on the semantic level, with a good description of what is meant by what type of information, and with standards that are can be used to access the information. With sound measures on the level of confidentiality, availability, integrity of the data, based on risk management system, because if people don't have confidence in the system, they will not rely on the system, and the system will not work. Of course, with a good access authorization and logging system, so that only those people who need to access the data and to process the data have access to them, and that afterwards you can have an indication, the citizen can have an indication about who has accessed and used his data. Measures on the level of computer literacy, with a cooperation between all institutions based on entrepreneurship and teamwork, because if you have silos between all those institutions, it will not work. You will not have the possibility to deliver integrated services. Cooperation that is based rather on the search of added value for citizens and companies, rather than on existing legal competences. We change a lot of laws to make it possible to reorganize the processes, even if this needed some reorganization on the organizational level. With a cost-efficient use of ICT based on cloud services, reuse of components, I will come back on it later on. A solid ICT architecture with agile development, with user implication, so that you can directly see what are the advantages and you have buy-in, based on continuous innovation, and as I told you, reuse of components and services, an API approach. API is the abbreviation of application programming interface. These are components that are through interfaces can interact with each other. I will explain it later on. I can say that all components and all services that we have been making are open source, available in a reuse catalog, and that everyone can reuse it if you want to, without loyal fees and so on. A service-oriented architecture, but that's more technical. Of course, using new technologies and using new possibilities in the area of mobile applications, of cloud computing, because it has a great advantage in the area of cost reduction and faster time to market of services. Big data analysis for fraud prevention, policy support, but also detection of non-take-up and automatic granting of benefits, and even techniques such as artificial intelligence for virtual personal assistance, machine learning, support of big data analysis. And to organize these things, it is useful, in my opinion, to have an institution that is a driving force, that acts as a driving force in that respect. So let the machines do what they are good in and use the human skills there where they have an added value. So what is the specific Belgian situation we started from? So we have about 11.5 million citizens, 230,000 employers. We have about 3,000 public and private institutions at several levels, on the federal level, the regional level, the local level, that are dealing with several aspects of social protection, collecting of contributions, delivery of several types of benefits, child benefits and employment benefits, benefits for disabled people, reimbursement of healthcare costs, holiday pay, old age pensions, and also supplementary social benefits, so tax reduction, or a social tariff for electricity, gas, water, and so on. The reason why there are so much institutions is that it has been created historically, sector per sector, that some initiatives have been taken by the companies themselves, other by the government. So, and we are in the situation where those institutions exist, and where they all have their added value, and the importance is to make them cooperate. So what we were facing 30 years ago was there was a lack of well-coordinated service delivery processes, which led to a huge avoidable administrative burden for everyone, a service delivery that didn't meet the expectations I explained earlier, with the suboptimal effectiveness of the social protection and insufficient social inclusion, too high possibilities of fraud. But there was a clear political will 30 years ago to solve those problems. And a scientific study, which I cooperated, has been worked out and has been the basis of the creation of the Crossroads Bank as an institution that coordinates the business process re-engineering and the electronic cooperation. So we started from this common vision on information management. I already explained some basic principles, but information is modeled in such a way that it is as closely as possible in accordance with the real world. So we are not collecting data, that's very important, that are interpreted versus a certain regulation. No, we are collecting factual data that describe as much as possible the real situation of the people, so that we can reuse the information for the application of several regulations. Information is collected from citizens only once. There is even the law gives the possibility to a citizen or to a company not to re-deliver the same information to another institution if the citizen or the company has already delivered the information to another institution. So all the social security actors are interconnected via a network, and if they need information, they will first look whether the information is already available within the network, and only then, if this is not the case, they will collect the data from the citizens and the companies, and everyone puts at the disposal the data he has to the other institutions that need the information to apply the social protection system. The collected information is validated once, according to a task sharing between all those institutions, because if you collect data, it is important before you exchange data that the data are correct, that you don't send errors to every institution. So we have a task sharing agreement between the actors, and the actor that is most entitled or that has the greatest interest has the obligation to validate the information. There's also task sharing in the area of data storage. So data are not stored many times. There is, for every piece of information, there is one authentic source, one database, one institution that is responsible to store the data, and they put it at to make the data available to the other institutions that need the information. The information can be flexibly assembled according to changing legal concepts. So the legal concepts are using the factual data to calculate the benefit. Every actor that has an indication that there is an error in the information has to inform the institution that has a responsibility to validate that piece of information. And then that institution has to check whether the error is correct or not. And if there is a correction, the correction is automatically sent to all institutions that need the corrected information or that got the wrong information before. Once collected and validated, the information is stored electronically and exchanged to avoid transcribing and re-entering the data again and again. The electronic information exchange can be initiated by either the actor that disposes of the information, or the actor that needs the information, or the Crossroads Bank itself. So if we have an indication that the address of someone has changed, automatically we'll send the change of address to all institutions that have a file on this person. So it's not only a pull system where the one who needs the information can ask for the information, it's also a push system where data that are relevant are sent automatically to those who need the information. I will come back how we organize it via reference directory in detail later on. There is a common functional and technical interoperability framework. All standards are public as well on the technical level. So the standards to exchange data between computers, but also on the semantic level, and to have the guarantee that what is meant by information pieces and by data is interpreted in the correct way by everyone who gets the information, who receives the information. And the available information is used for automatic granting of benefits and pre-filling when collecting data. We also have a common vision on information security. I will not explain it in detail, you can read it, but the main principle is that data are only used for purposes that are compatible with the regulation, and that before exchanging the data, there is a check by an independent information security committee that is designated by the parliament to check whether the institution that asks for the information really needs the information. And it's the information security committee that grants access authorizations to personal information, after having checked whether the access conditions are met. These access authorizations are public, so every citizen has an insight in what data will be exchanged in what situation in very detail. And every actual data exchange has to pass the Crossroads Bank for Social Security. So the access authorization, the decisions about what data can be shared, is taken by the independent committee designated by the parliament. But when data is exchanged concretely, it has to pass a trusted third party. It has to pass the Crossroads Bank that checks preventively whether these access authorizations are met. Every time that information is used to take a decision, all the information that is used is communicated so that the people can check whether the decision is correct, and they have the right to access and correct the data, and also to have access to who has accessed their data to the loggings of the system. So here you see the network. It's functioning as a star-shaped network. All social, I cannot put all 3,000 institutions on it, but we have sectors of social security. They're all interconnected via a star-shaped network. They are connected with the Crossroads Bank, and they can access each other's data via the network after that the Crossroads Bank has checked that the access is authorized. Technically spoken, physically spoken, the network is a backbone where the institutions are connected through firewalls and routers, and we use the internet with end-to-end encryption to have access with the end users. That means the socially insured people, the companies, and so on. As I told you already, it's very important that you have, before you automate the system, that you have also the necessary attention for process optimization. If you don't optimize the processes before you automate them, you risk to consolidate suboptimal processes. Again, I told you we came from 800 paper-based processes. We have now 200 electronic processes. That means that 3 out of 4 processes, we killed them because they were not efficient, they were not necessary anymore, and that's very important. First, optimize the processes and then automate them. It's also important, in my opinion, people want to have integrated services delivered at key live events. So you need integrated value chains between institutions, so mutual coordination between internal and external processes, so that you can deliver integrated services to the citizens. When a child is born, the child benefits have to be granted. The child has to be has to be entitled to get reimbursement for health care costs. It has to get some vaccinations and so on. So the only one's collection of the fact that the child is born gives access automatically to all the services that are, all the benefits that are granted. And it's important, it's very important to have an involvement of the users of the processes so that they can intervene and can indicate you what is necessary. So what is the situation today? We have this network between all those actors. We have a unique identification key for every citizen, every company, and every establishment of a company. It's very important to be sure that when you are exchanging data about people and about companies, that you are talking about the same people, that you don't have wrong data about another person than the person that for whom you need the data. There is this agreed division of tasks on the area of data collection, data validation, data storage. It's not always the one who collects the data that validates the data and that stores the data, but we have agreements for every of these three aspects. As I told you, we have about 220 electronic services between all those actors. In 2021, we had about 1.5 billion electronic messages. That means as many paper exchanges that have been saved. We have also direct electronic service. So the 200 electronic services are services for a data exchange amongst the actors in the social sector. So people give the data once and they exchange it when it is needed. We have also a number of electronic services for the citizens that they can use to deliver to give the information to the social security system as a whole. And people can also use those services to follow the automatic granting of benefits based on this back office electronic information exchange. We have about 50 electronic services for the employers. We only collect data from the employers. So before, the same data were collected again and again and again. So salary data were collected at the moment that that the social security contributions had to be calculated. But when one of the employees became unemployed or sick, they had to re-deliver the same information about the same salaries according to another legal definition. So this is not the case anymore. Now we have declarations, electronic declarations. It's fully automated between the software of the employers and the software of the social security system. We have declarations at three moments: the beginning and the end of a labor relationship, a quarterly declaration of the salary and working time, and then when an when a social risk occurs. We have also simplified a lot those processes. And in 2021, we had about 35 million electronic declarations, 98% of them application to application. So not using a web application, but directly exchanging data between the personnel administration software of the company and the social security system. For the citizens and for the employers that don't have an integration application to application, we have an integrated portal and mobile applications for all those types of transactions. And we have a data warehouse that contains statistical information with regard to the labor market and all branches of social security to support the policy. I mentioned already the reference directory. So this is a very useful tool. We don't centralize the data. There is no centralized storage of all data about all citizens. No, we have a task division between the institutions, I told you. But we have a reference directory that indicates what people have a file at what institutions. And if they have a file at a certain institution, what is available, what are the data that are available, and what are the data that can be accessed by this institution. So the people within the reference directory are identified by this unique identification key I mentioned. And we have 4 tables. The first table of this database, of this reference directory, is what people are having a file at what actor for which period and in what capacity. That's the directory of the data subjects. Then we have an indication if a person has a file in a certain institution, in a certain capacity, what is the information that is available, what are the services that are available. The third table is a table that indicates if an actor has a file for a person in a certain capacity, what are the services that he and the data that is authorized to access. And then we have the subscription table, what data has to be sent automatically when an event occurs to everyone who has a file on this person. So if you have a change of address, for instance, the data are sent automatically. So we don't have a central data storage of all data, all social data about the people. They are decentralized, but we know who has a file at what institution, what data are available at what institution, what data can be accessed by what institution, and what data has to be sent automatically when they change to what institutions. We have another useful tool, that's the electronic identity cards. It's a card that has a chip, a processor chip that contains the identification, basic identification data of the holder, and that also permits to authenticate the identity of the holder. So people can put the identity card in the reader, can enter a PIN code, and then we know that they are the ones that they pretend to be, the one that they pretend to be, and we know his or her unique identification key. We have also means for mobile authentication based on this electronic identity card. You have an overview here. You have card readers, and it can be also installed with the bootstrap process on a mobile phone. You can put a mobile authentication means based on a one-time reading of the electronic identity. Then we have the distributed databases. So according to this task division, we have the reference directory at the level of the Crossroads Bank. We have basic identification data in a national register. We have basic identification data of companies in a company register. We have an employees directory, a workforce register, a database about the salary and the working times, and database about who is insured due to its work, due to assimilated periods. All these databases can be consulted interactively, can be consulted by batch processes, or can be used to automatically communicate updates. And that we have a lot of these are the 200 processes, pre-processed messages, how we call it, messages, standardized messages according to interoperability standards on employment benefits, benefits in case of career break, child benefits, old age pensions, and so on. I can give you a link to the description of all those messages in detail, as well on the technical as on the semantic level. So 1 or 2 examples. So this was a situation 20 years ago. An employer had to send information about the salary and the working times to the institution that calculated the contributions, and every time that a social risk occurred, had to resend the same information and reinterpret the same information according to several regulations. He had to read, in certain cases, 80 pages to fill in 3 types of data to be sure that the information that was delivered was correct. Today, the HR from the personnel administration system of the employers has 11 components of the salary, has about 30 types of working or assimilated periods. The software of the employer gives once every 3 months the data to one institution, and if the other institutions need, the other actors need the information, they can get it via the network. And we delivered the control check programs to the employers, so the number of errors has diminished from about 30% to less than 1%. So that's a huge simplification. It's also a huge diminution of the costs for everyone. Then you have the declaration of social risks. When a social risk occurs, when someone is in incapacity for work, is unemployed, is retiring. So there we have 3 moments of declaration. We have the start of the social risk, the continuation of the social risk, and the end. And we have structured the declarations, identification data, if necessary, salary and working time data. Only if necessary, because if we have the historic information, we get it from the database. But there can be periods for which the quarterly declaration has not been done already. Then we need a kind of mini declaration and the specific data concerning the social risk. We also have it for people that go abroad, but I will not explain it in detail. We have translated these principles on the common vision on information management and on information security, and on the obligation to use the identification keys, unique identification keys. We have translated in a law that creates the Crossroads Bank, that creates the control committee, the information security committee, that regulates the probative value of the electronic information storage and the information exchange, and that has been the basis to gradually harmonize some basic concepts semantically. We have a very layered architecture with a very service-oriented architecture, so that components, that services can be integrated very easily. That is very important, in my opinion, to have cost control, to have faster time to market, to have a greater flexibility when the law changes and so on, with the greater security. So service-oriented architecture means that it is very modular, very interoperable, very extensible, and really used, really based on the reuse of components and data. So no legacy systems where you redevelop some components X times, but very modular components that can be assembled towards integrated services with a layered approach. We have databases, we have business services, we have orchestration of business services, and we have a presentation of the business services to the companies and the people, either via an application-to-application integration, via direct contacts with their software, or via a portal. We are shifting, we have been shifting to really an API economy, so that components that we have are described via publicly documented interfaces that can be accessed, and that users, developers outside the social sector can assemble to new apps and services and differentiate to several users groups. So the advantages of this approach is that you have cost reduction because we use a lot. You have a complexity reduction because you don't have no more big monolithic systems anymore. It's a driver of innovation because everyone can assemble the components to new services that are really concentrating on the needs of specific groups. You have stimulation of partnerships and stimulation of standardization. And you can change components and replace it by other ones without that other components have a negative effect on it. So here you see a more technical way how we do it with the products we use. You can have a look at our use platform. You have the website here, the link. So every component that we have been developing is documented. I don't have it in English, it's in French and in Dutch, but you have a description of the databases, you have this description of the interfaces, you have this description of the security measures, and you can access and download even the code in open source, and you reuse it if you want. To end my presentation, the Crossroads Bank for Social Security has been the driving force throughout this process in the social sector. 12 years ago, we redid it in the health sector with the e-health platform, but that I will not explain now. It's based on a cooperative governance. So the board of directors of the Crossroads Bank consists of representatives of companies, citizens, and the actors of the social sector. So all stakeholders. It's very important to have buy-in from all stakeholders. The CBSS is created by law and has the mission to define the vision and the strategy on the government and social sector. I explained to you the basic vision and the basic strategy, the common principles to define, implement, and manage the interoperability framework on the technical level, on the semantic level, and to organize the business process re-engineering and the orchestration of the new services, to stimulate the development of service-oriented applications based on this layered and service-oriented architecture, to be a driving force for necessary information, and to do consultancy and coaching. As I told you already, a very cooperative governance, so the people about whom we are exchanging data are represented within the board of directors, and we have user committees that are working out the processes. What are critical success factors and obstacles? It's very important, in my opinion, to have this common vision on service delivery, to have access to policymakers at the highest level. We have been in continuous cooperation between the several governments on all levels, because you also need the possibility to simplify the law and to simplify the protection system and to simplify the information management that is used to organize a social protection. With trust of all stakeholders, in mutual respect and in very high level of transparency, respect for the legal allocation of competences between actors. If you don't need to use ICT to change the organization principles and to change the repartition of competences, the allocation of competences between the actors, because then they will be against the automation. So cooperation based on distribution of tasks rather than on centralization of tasks, and focus on more efficient and effective service delivery and cost control with reasoning in terms of added value services for people. And seeing the electronic service delivery process as a structural reform process with business process re-engineering and according to a multidisciplinary approach, not only legally and technically, but also about change management, coaching, training, security, business process optimization. It needs lateral thinking, an appropriate balance between efficiency on the one hand and security on the other hand. Quick wins. The first 10 years of the existence of the Crossroads Bank, we had every month we had a new service that was available. That's the best way to convince people to use it, and not to continue discussing. Several services were very limited services, but by making added value available to the actors in the social sector, to the companies, to the people, they use it and they become convinced of the process. An adequate legal framework, and of course, an architecture that is adaptable to ever-changing environments. You need skills and knowledge. That's why we created an association that hires ICT specialists at normal market conditions and puts them at the disposal of the several actors. And we have the possibility to reinvest efficiency gains in innovation. Service-oriented architecture, I explained it, and a need for radical cultural change within the government so that you have communities, teamwork, and not hierarchical systems, and that you reward entrepreneurship within the government institutions. The advantages, we don't have only gains in efficiency, so less costs. The Belgian Planning Bureau calculated that every year we save about 1.7 billion euro for the companies because they have an integration from application to application. They don't have to fill in forms anymore. Everything is done automatically between their software and the software of the social security sector. We have a unique information collection. We can reuse the data. We had a drastic reduction of the number of contacts between the actors because we delivered the control programs before they sent the information, and we have a functional task sharing. We have more services that are available at any time from anywhere, and the services are delivered in less time. We have the benefits are allocated much more quicker. Waiting and travel time is used. But we also have gains in effectiveness. We have a better social protection. It's only at a lower cost and quicker, but it's also better social protection because we deliver more qualitative services. Data has been validated once and is reused. And we also are using the data to automatically grant benefits, to have an active search for non-take cap using data warning techniques. We have people that can use personalized simulation environments. People can see, I'm 50 years old, what will be my old age pension in 15 years, and what will be the consequence if I work part-time for the next 15 years. So personalized simulation environments based on this data, and a better support of social policy and a more efficient combating of fraud. So I hope that I respected the time frame, and I'm available now to answer questions. In the presentation you find on my website, I still have a lot of other information about the implementation order, how we finance the system, what are the management controls techniques, the integration in the European network, the detailed approach on information security and so on, but that you can read if you want. So thank you for your attention, and if there are some questions, I will try to answer them.
Fantastic. Thank you so much, Frank. And you were bang on time. I'm impressed. and also impressed at how you managed to condense so much information in such a simple and concise way. So huge thanks for that. And I can reassure participants that you will have access to the slides. They'll be shared on the website of the Convergence Initiative and also socialprotection.org. So you'll be able to browse even the treasure trove of other slides that haven't been shared with you. And if there's any specific slides you want to come back to or focus a bit deeper on, then you're also welcome to kind of ask that as a question, and Frank might be able to go a bit deeper on some of the slides he's already shared. A quick reaction from my side before I hand over to our first discussant Ernesto Broderson is just a few of my takeaways, and there would be so many, but I'll just focus on 4. And one is the fact that your starting point was the needs, kind of both of citizens, but also of the different institutions. So starting from the policy operational needs and taking that as the beginning of your journey. So you could actually be proactively using kind of ICT and digital to be responding to very specific needs from that perspective. Then the second point I wanted to just kind of focus on quickly is the journey that you took in order to be doing that, and how collaborative and cooperative it was, that the fact that it wasn't just a digital mirror of the non-digital environment. It was actually a process of that, as you said, business process reengineering, making sure that kind of you were looking forwards on what ICT could do for you in terms of responding to the needs that you had identified, and doing that in an integrated way, thinking about integrated value chains across different institutions, that iterative process of collaboration over time, which is something that obviously a lot of the countries that are listening today, they're in the process of doing this as we speak. And that's all been embedded for you in that common vision on information management, the common vision on security, which is sort of the crucial coming together of actors and getting that in writing. Then a third point I wanted to stress is the fact that intrinsically you also have a focus on inclusion. You mentioned at the beginning, for example, the issue of having multiple doors, for example. If for one person, one approach to registration doesn't work, something else might be working, and being able to offer that using the human interface and using where ICT cannot arrive, because there's many people who will be facing barriers. So having a system that can reinvest savings in innovation, but also in inclusion for those who face the highest barriers, which includes also your proactive approach to be registering people who might not have registered through your system, and using the data warehouse also to be identifying pockets of non-take-up and then proactively looking at those. And then obviously the crucial theme for today is the theme of having sometimes those of us working on social protection information systems, we make the mistake of thinking, for example, of a huge registry containing a huge amount of information that is then used for multiple schemes. And what you're talking about is no centralized data, but having this decentralized approach where each institution, according to their mandates, is storing and curating data and sharing it with all other institutions, and having systems that enable that. So you talked about your reference directory with the importance of standards. You talked about obviously the unique ID at the heart of everything. You talked about your shift towards an API economy, and obviously you're also focusing on the layered service-oriented architecture and how that supports you in all of this. So very brief summary of a very dense and interesting presentation. And I'm going to now hand over to Ernesto for your reactions and questions to Frank. So we'll have a brief interaction with Ernesto as our first discussion. Over to you.
Thank you, Valentina. And I'm pretty impressed, Frank. We've all heard quite a bit about Belgium's Crossroads Bank, and it's a privilege to be able to hear from firsthand everything what it has come to be over these such a long history. And I'll try to keep it short and ask 3 questions, and I'll describe them a little briefly and maybe we can have a very quick discussion around this. You describe a really fantastic journey, that's 30 years long, and many countries, interoperability is still in the works. And I think you were describing, and I think you emphasized a couple of times, and I couldn't agree more, that there has to be a driving force. And Crossroads Bank had a specific history around it, being an entity that would facilitate different services across different institutions. And perhaps, and the last some of the last slides that you showed the governance framework that exists, was, I understand, as it is today. But I think it might be beneficial for the people, especially for those who are starting and thinking about this driving force and coming up with a common understanding of where things should be. It might be good to understand how this came to be, because I see there are significant challenges that exist in institutions that are coming together with this common understanding and being able to transparently interact with other institutions, opening up their data, opening up their processes, so that these processes can be harmonized within one another. And some of the challenges, both political, some of them financial, and many others that could exist. So that's a little bit of my first question. I'll go through the three real quick, and then maybe we can have a quick discussion around that. The second is a little bit more technical, has to do with this distributed, I think, approach that Valentina was also mentioning. I think this is a really a very interesting example where sometimes it's not possible to have a centralized approach, and sometimes it's better to just build these APIs that you have right now and use, I think you called it push systems, or some people call it publish subscribe, through this reference directory. And a little bit related to the first question is, this reference directory, as I understand it, is Crossroads Bank owning and managing this reference directory. But it does require, I think you talked a little bit about, on the security standpoint, about who can join, how is this managed? Again, maybe a little bit more of the history, and what does it mean in terms of managing and maintaining that registry? And a little bit more technical with respect to the distributed approach is, maybe if you can describe a little bit of the implications around maybe understanding how do institutions in Social Security can now, in a distributed approach, use these big data and analytics structures that exist today with machine learning and artificial intelligence, which are very, very common today, that are now have to deal with distributed information across different agencies, which may or may not limit the capacity of, at a policy level, at a intergovernmental agency level, to be able to extrapolate perhaps different inferences or different conditionalities that exist in this type of structure with a distributed approach. And the last, it's maybe a simpler question, but it has come up in a couple of countries, and I think you probably know a little bit of some of the challenges around interpretation. And I think you mentioned, you actually used that word around interpreting and being semantically compatible about what does it mean to be part of that, and maybe even touch, maybe a little bit more advanced, but maybe even touch on the ethical implications around that, because as you know, you have some neighboring countries, not to name them specifically, which have had ethical implications around the use of technology around collecting and incorporating different sources of data to extrapolate and act on, specifically on social protection and even enforcement actually to be able to act on that. Obviously, I think that's a lot more advanced for many of the audience, but I would definitely personally love to hear your thoughts about that. So those are my 3 questions around history, the distributed approach, and the semantic interpretation. I said I would try to be quick and be more than happy to hear your thoughts. But again, I commend you really well. It's a fantastic experience and showing. I think it would be really beneficial for everybody to understand how you got there. I think 30 years ago, many services didn't even exist. Technology wasn't even existent. Cell phones use was not existent, and that has digital transformation implications around institutions such as Crossroads Banks, and it is not a one size. It is not a one shot. And my last really final comment is sometimes legacy systems of tomorrow are being built today. No, so how do you keep up? No, and I think as it goes to Melis's introduction at the very beginning, how do you keep up after 30 years? No, you have whiter hair than I do. After 30 years, how do you keep up to have Crossroads Bank establish a digital transformation strategy that keeps up with all the technologies and the solutions in order to have such a proactive social security and integrated system? With that, I'll pass it back over to you, Frank, if that's okay, and happy to continue discussing.
Fantastic. Over to Frank. And in theory, you have 5 minutes to answer, but of course, I'll give you a couple more because those are big questions.
Yes, okay. I will try to read because I prepared some slides about the first part. I will reshare my screen. Okay. You see the screen again?
Not yet.
Not yet.
There, yes.
Okay, so that's how we tried to gain the support. I already told it. In my opinion, you need a very long-term vision. I explained it. What are the basic principles of this vision? That is technology agnostic, so that is not relying on standards at a certain moment. We started with developing an own middleware in assembler. Then we went to middleware systems. We started from Edifact. Now we have 3XML, JSON, and so on. So that's not the importance. It's to have a sound basic vision, technology agnostic, and combined with quick wins, in my opinion, because you can continue discussing every time, but the best way to have people to have people work with you is that they have advantages, that they are in win-win situation, that it becomes their project and not your project. And that's about change management. That's why it is so important to have this cooperative governance, that every stakeholder is implied, and that what you agreed within this board of directors, everyone does its part. So the representatives of the companies, the representative, the trade unions, and so on. So they are all represented in our board of directors, and when we agree about things, they do it. We have every year we ask every actor about his new needs, and we take into account, and we have a global plan every year, again and again, since 30 years, to do it according to this common vision. Of course, you need political sponsors, but we had the possibility to start with a very small team. indirect support of the government, consisting of, on the one hand, people like me that came from the scientific world and that had been describing the proposal, experienced civil service who have a sound human network with all levels so that you have buy-in, a number of political advisors so that you have a direct contact, and that what has to be changed can be changed even if it needs changes in the law and so on. Based on multidisciplinary skills, again, business process reengineering, change management, ICT, legal, and cooperating between the several government levels. So that's how we started. And what was the implementation order? So we first defined a common vision. We demonstrated the feasibility. So the first programs I developed myself. Then we got some political and public support of the social partners, so the stakeholders, and the social security institutions. Then we created the legislation to create the Crossroads Bank and to translate a common vision. Then we integrated the unique identification key in all information systems, because if you don't have that, you cannot exchange data. We implemented the architecture, but again, a little bit technologically agnostic. All data exchanges in the network are based on 3 archetypes. So we are sending information and we only need return of receipt. We are sending information and we need an answer, and we have an answer. So everything is a concatenation of these 3 types of archetypes. And this is very important, because then you can change it from the technical environment quite easily. Then we gave controlled access to the databases with some authentic data. We re-engineered the processes between the back office institutions. If that work was done, we re-engineered the processes with the companies and then with the citizens, and always combined with the necessary changes. So that about the history, how we gained support, how we started. I hope this gives you a good overview. So the second point about decent distributed data, big data analysis, reference directory, and so on. In fact, the big data analysis, especially for the policy support and also for fraud protection. So not for the automatic granting, that's an operation, but fraud detection and policy support, we do it on pseudonymized data. Okay, so we take the data from the operational systems, not all the data. You don't need all the operational data. It's a subset. But we use a subset and we pseudonymize it and we put it in a data warehouse. And within this data warehouse, we can use statistical programs, machine learning programs, and so on. It's pseudonymized, so that means that if needed, we can re-identify the people. So, for instance, we are detecting fraud patterns on pseudonymized data, but when we have indication that there is fraud, we can re-identify, and then the social inspection can use the data. Also, if you want longitudinal policy support, you need, of course, to have throughout time addition of data to the data warehouse that you're sure that you're speaking about the same people. But so we are not using the distributed system to have big data analysis. That I agree with you, that doesn't work. You need, but the operational systems have another. They are event driven. They are very modular. So the big data analysis and the use of artificial intelligence and so on is done on pseudonymized data in data warehouses. Okay, everyone that is connected to the network manages its own data in the reference directory. So it's the institution that has a file that indicates that he has a file. There are some control techniques. For instance, you cannot be affiliated to several sickness funds at the same time in Belgium. You only have one sickness fund. So it will not be possible that the second sickness fund indicates that he has a file on you. If you change the sickness fund, there will be a certain overlap. But these are managing rules in the reference directory. But the indication is done by the institution. And then the semantics, again, in my opinion, I studied law and ICT. The main problem is that a lot of institutions were asking legally interpreted information from the companies and the citizens. So the application of the law was transferred, the interpretation of the information to apply the law was transferred to the citizens and to the companies that don't know the law, as well as the institutions that have to apply it. That's why we said, okay, we will not continue to do that. We will not say, give us an amount of a salary according to that legal definition. No. We took all legal definitions of a salary, and they can be different in the several sectors. You cannot always harmonize it, because if you have, let's take the situation where a certain component is taken into account for the calculation of contributions, but not for the calculation of a certain benefit, or vice versa. If you want to harmonize it, either you will lower the benefits, or you will have more contributions. Okay, that will not be available, possible politically. It's difficult. Okay, you can have this discussion, but it will be a difficult discussion. But you don't need it. We took all definitions, legal definitions of salary. We decomposed it in a number of factual components, and with 11 components, we can calculate every salary, legal salary definition. We are asking the 11 components. And we put in the law that if there would be a new definition of a salary, it could only refer to one or more of these 11 factual components. Otherwise, they had to get the meaning of the National Labor Council, where employers are represented, and they would say, okay, but if you ask us a 12th or 13th component, we have to all companies have to change their information systems. Is it really needed? Since 2003, we didn't have a new component, factual component, so they can change the legal definitions, but they can also, it's a kind of Lego bricks that you offer, and you can say you can build what you want, but with these bricks. Okay, if you change the brick, you can do it, but then you have to take into account that you will have to change all ICT systems behind. So we tried to have a distinction between the data collection, that's factual data, and the use of the data in order to apply a law. And then you can have good common semantic definitions of the factual data. Is it clear? Sorry, but yes.
That was very clear. Thanks, Frank. And thanks again for kind of providing practical examples that bring kind of what Ernesto was asking to life, which also speaks to that journey, kind of starting from the vision, maintaining the technology agnosticism, and then moving in kind of slowly overcoming different hurdles over time, including these legal issues, which are fundamental in the background. Okay, so thank you, Ernesto. I'm going to now hand over to our second discussant, Anita Mittal. Over to you, Anita. You're still on mute there.
Yeah, the mute button was giving me trouble. Thanks, Valentina. And thanks so much, Frank, for that interesting presentation. I had heard you 5 years back, And that time I was hearing you with an open mind, what is this Belgium's cross-bank system? But today I was listening, from the perspective of, with the lens of interoperability. How did Belgium achieve interoperability? And listening to this was very, very interesting for me, because I heard all the terms which Melis had laid down in the beginning of the presentation as to what are the objectives or what is the vision of Digital Convergence Initiative, which is to bring in efficiencies, reduce time and cost, make components interoperable, plug and play. All those terms, surfaced in your presentation. So it became a validation of that interoperability will achieve what the Digital Convergence Initiative is hoping to achieve. We also heard from you, the API-based approach, definition of data standards, definition of processes, standardization of this, maintaining a reference directory. And this is what we are also hoping to do, not just for Belgium, but at a global level where we can do a consensus-based approach. So this was again a validation of the approach, and the wealth of information which you've made us available through this reference directory, which you said is available on the website. I think it's definitely going to be a great asset for this initiative and a guiding light. So with this, I think probably now I just want to ask a few follow-up questions or clarifications. First quick question, because I know Crossroads Bank reminds me of the Crossroads system of Estonia, with which I'm quite familiar. So I wanted to check, is Bank platform, is it open source? That's a quick question. Is it open source or it's only for the use of Belgium? Frank?
I answer directly, or you put all your questions? It's the same for me.
No, I think we'll keep it interactive so that you don't.
Okay. Yes. No. So everything we have been developing ourselves is open source. Okay. I can open source or reusable. You can have the code if you want to, but in some situations it's more easy to have a service than to have the code. Eh? But we have a container technology so that you can reuse, put the containers on another. So we are fully working. So not 30 years ago. 30 years ago we were working on it over our own infrastructure, of course. But since 10, 12 years, we have migrated to a cloud environment. It's a hybrid cloud. Most of them, so we have a government cloud within Belgium, not only for the social sector. So it's a cloud on premise, but it's a cloud-based solution. And we have containers, so you can copy. So the reference directory, for instance, I cannot explain it in detail, but we have a central reference directory across sectors, but in some sectors there's also a sectorial reference directory. Okay, so they can use a container, they reinstall it, and they can have a kind of plug and play system to use it in there. So I gave you in the presentation the link to the service catalog, where you can have an insight in the authentic sources, in the interfaces. For instance, our system for access and user and access control, authentication, and so on. It's public. Okay.
Thank you so much.
But we cannot. What we cannot do is to install it in other countries. We can give it to you. We help to install it. But you need a local. The social security system is not the same in every country. So you have to not the organizational aspect, not the legal aspect. So you can reuse, but it is not for everything plug and play. Huh? Yes.
Thank you so much. I think the other question which I have is, I'm seeing that your CBSS is coming as a star-based approach, the way you said it. So if a department wants to get data from another service through an API-based approach, what is the role of CBSS? So it has to first call the CBSS API endpoint, and that CBSS will forward the request, or is there a matrix-based like in Crossroads? Anybody can talk to anybody?
Historically speaking, it was the functional the architecture of the functional network was the same as the physical network. Okay. Today it's not the case anymore. That's why I explained you have a backbone. You have a backbone, and APIs are described on the backbone.
Okay.
So it's not so institutions can access physically each other directly without passing infrastructure of the Crossroads Bank. But in the situations where we have to check where the cost, I explained to you that the access authorizations are given by the Information Security Committee, and that at the moment of the actual exchange, we have to check whether these authorizations are met. Okay, so at that moment, it's a service of the Crossroads Bank that is called. So you have an API to get access, but within the API, you can have a call for our API to check whether the institution that needs the information is entitled to get the information for the institution on that person. Okay, so it's a set of APIs. Historically, it was a star-shaped organization because we didn't have the internet, we didn't have but today it's a backbone with APIs where some APIs will call other APIs if they need them. Okay. It is even 12 years ago when I started the health platform. In the health platform, we have about 15 basic services, 15 APIs that are being used. It's the same principle.
Yeah, so the other thing which I wanted to just quickly clarify is that you mentioned that for any personal data, there is a third-party check. And that third-party check is basically, is it done by a system like CBSS, or is it a sample based by an entity?
No, the Crossroads Bank is a kind of preventive, trusted third party that preventively checks whether the institution that asks for the information is entitled to get it. About that, but we don't want that. Let's take an example in the health sector. A medical doctor that has a therapeutic relationship with you can access your data, but a medical doctor that doesn't have a therapeutic relationship with you cannot access the data. So this is a preventive access control that has to be done. Okay, that's why there is this kind of trusted third party, because otherwise people will not trust the system. People will not. You cannot have a system where citizens of at least in our country, it would not be acceptable that every social security institution would have access to all data about all people without any limitation and so on. If I'm affiliated to a sickness fund X, a sickness fund Y will not access my data. Okay.
Okay. I think another question which is in my mind is, your APIs, right? So your APIs are they push-based or pull-based or a combination of both. So I think you had mentioned there are certain events like change in salary or loss in job. So does that event result in a notification broadcast to entities which have subscribed?
The two types are possible. For instance, so we had a COVID crisis. We had a lot of institutions, a lot of situations where local institutions helped people financially because they could not work and so on. So we have the two. We have either an institution that wants to deliver new benefits and that has to know the social status of the person in another sector, or we have the inverse, the fact that someone is a handicapped person and is entitled automatically to have a social tariff on water, gas, and electricity. So the first is a pull system, the second is a push system. We are using the same APIs to do it. It's only a way to organize the data flows. It's a kind of orchestration above the APIs. Yes.
Yeah. So in this orchestration, so do you have that at a periodic pace you will do a push, or it is event-driven push?
That depends on the agreements that we have. So, for instance, if If a municipality says we give a tax reduction to a citizen based on his social status at the 1st of January of every year, okay, they will come and collect the data as it is on the 1st of January every year. Okay, if you have another institution, for instance, in the gas or electricity sector, where people can, so a municipality, you don't choose it, you live somewhere, and the municipality where you live will fetch the data. But for instance, my electricity provider, I can choose it. So a handicapped person that changes his electricity provider throughout the year, automatically, when he says that he has changed, we will send his situation to the new electricity provider. That's a push system. Okay, we only need to know the event that we have to give the information to the new institution. Okay. Okay. So it's very flexible. That's in our situation we have the two. So you saw that. You have in the reference directory we have a subscription table. So institutions can say, if that event happens, automatically we want to have the new information. We will have other situations where people say, okay, no, we come and ask for the information once a year, and then you give it. Okay.
Okay, that's very interesting. So that clarifies, you know.
In my opinion, ICT should enable the possibilities and the organization, not the inverse. So that's why we have tried to create a very flexible system by which we can use a push, a pull, a batch, an event-driven. That's all possible. That's about, and the APIs are the same. It's about an orchestration above it. Yes.
Yes. Yeah, that makes a lot of sense. The other thing probably which is linked to the discussion going on, you know, using identifier from your digital ID. So I heard that your unique identification number or the national ID number is the identifier which is used to connect all the data records across the different databases. Is that correct?
Every Belgian citizen has one unique identification number that is used across all sectors. We don't, I know that in some countries you have the problem that if you have a unique identification key that is the same, but let's take the health sector and the social sector. You can have two identification keys, but what do you do if I'm going to a medical doctor and I need to get reimbursed for the healthcare costs? Then you need a combination of these two keys, okay? So we said no, every Belgian has a unique identification key, and the security is not organized by separate keys. The security is organized by the fact that every database, if you want to have access to a database, you need to pass a trusted third party. It is a trusted third party that, according to the decision of the Information Security Committee designated by Parliament, it will grant you access or not. Okay, and the rules are very clear. So, but if you want to exchange data, you are sure that you are talking about the same person.
Yeah. So when you talk about trusted third party, is that an entity or an organization?
That's the social sector. The trusted third party is a Crossroads Bank. In the health sector, it's the e-health platform. So we don't. The law prohibits that the Crossroads Bank or the e-health platform can deliver content services. So we are not allowed to calculate benefits, not allowed to calculate contributions. We are only allowed to organize the data exchange to make the processes more effective and more efficient. But that's why we can be called a trusted third party. Okay, we don't have any interest to have access to the data ourselves. We don't do policy support. We don't do fraud detection. That's all done by the institutions, and we are only organizing the exchange of data according to the authorization rules determined by the Independent Information Security Committee. So there's a separation of duties.
Thank you so much. This is
If you are implied yourself, if you have an own interest in having the data, you cannot be a trusted third party, of course.
Okay, thanks. I think that's very clear.
Yes.
I think now I'll probably hand over back to Valentina so that we can give opportunity to our participants to pose their questions to you. Thank you, Frank. Thanks once again. Back to you, Valentina.
Thank you so much, Anita. And kind of that gave us a good combination of some very practical technical answers, but also it gave us insight into some of the underlying principles, kind of this one on the governance and the separation of duties being crucial, and how you maintain trust in your institution because you don't have any policy duties or fraud detection duties. I think that's pretty crucial. The fact that you're working across that whole data ecosystem, and very often in our work in low middle income countries, sometimes we focus just on the social protection sector and sometimes just on the provision of social assistance. So when we're talking about social information system, we actually need to be thinking across social insurance, social assistance, and provision of labor market policies potentially. And
if you have social assistance, you need that there are means tested benefits. So you need information about the income and not only the income, labor income, but also other income sources. So you need, I suppose, an integration or a data exchange with the fiscal tax system and so on.
Exactly. With the challenge being that with very high levels of informality, often the tax data is very patchy. So maybe less than 10% of population represented.
Yes.
So
Okay. Yes.
These are the types of challenges that we're dealing with on a daily basis. Fantastic. So let me come to the audience questions. And obviously, again, where a lot of us are coming from a perspective of quite big contextual challenges. So the first question is, what are some of the pitfalls and maybe mistakes that you discovered early on in the CBSS interoperability journey that you would recommend others to avoid that might be starting on this journey now?
Yes, of course, the technology now is, you have much more possibilities now than 30 years ago. Okay, so don't try to copy it. We had a distributed, we implemented the distributed system, but based on a mainframe for the reference directory and so on. So I think if you have to do it today, go immediately to also on the technical level, very modular systems where we can reuse. We had to develop a lot ourselves. We didn't have middleware, orchestrations, software, and so on. So and take a lot of the shelf, even and don't try to if you take something off the shelf, use it as it is, because if you take it from the shelf and then you try to customize it, you will pay 2 times. So I think it's I did the e-health platform, started 10-12 years ago. It was a whole new technical environment with much more possibilities. And then, in my opinion, what is very important, we in the beginning, of course, in my opinion, it's important to have on the political level a vision on the long term, not only with the political parties that are deciding today, that have the majority today, so that we didn't do enough at the beginning. We looked at the government at that moment. It is important. You don't do this kind of things within 1 or 2 or 3 years. It's a long-term journey where you have to. So you need to have a real support on the common vision by the stakeholders and so on. So these are 2 things I would, when I would have to do it to redo it now, if they ask me to redo it in another sector today, these are two things I would do in another way, yes.
Really useful, and it tallies. I mean, obviously, the Convergence initiative, part of what we're trying to do is to make those off-the-shelf solutions available. Even though I think some of us would contest the no need to modify and tinker with what is off the shelf. But
that's the Pareto optimum principle.
True.
80 you will solve 80% of the problems with 20% of the effort, and do you want to do that, or do you want to have a? I agree that if you want to have if you don't want to change the system in the context, it will be much difficult to reuse components of other countries, but that's a choice.
True. And there's
that you have to make, yes.
That we had another event hosted by the Convergence Initiative on providers of open source software solutions.
I attended that event, yes.
So for the audience as well, if you haven't watched that one, that will be a useful one to catch up on. And also the other point you made on building for the future. So this is something we stress very often, is think through the system you might want in the future, even if today you're not able to offer that full range of services. Yes. Think through the full vision, which is that process you described at the beginning. Great. There's a more specific question here quickly on if there's any international standards such as HL7, FIR for APIs. Did you use any of those, or did you define your own standards entirely?
No, we use it. FIRE is a standard in the health sector. Right? So and HL7 also. So we try to use as much as possible international standards. Yes, mostly for 90% it's possible. Allez, let's take FIRE. You don't have in FIRE an agreement internationally spoken that you have one unique identification key for every patient. Mm-hmm. You don't have it, okay? So you will need to define some modifications, some sort add-ons on these standards. But of course, we try to reuse it. It would be very interesting also on the social, because HL7 and FIRE is the health sector, but also on the social sector. If we would have agreements, but that's a huge challenge. Let's try to define internationally spoken what factual data do you need, for instance, to determine a child benefit.
Yeah, absolutely.
If you are able to do that, I don't say that you have to harmonize the way you calculate the benefits. It's about the factual data that you need to calculate a child benefit. If this would be possible to do, it can be useful, because you have to rely your standards on something you are doing in a common way.
No, absolutely, and that is another of the objectives
in the European environment. We have ESSI, and we have business use cases, and we have been defining about 120 business use cases, but it's rather complex in my opinion. Yes.
Yes, definitely. We have another question on kind of digging deeper into the practical challenges faced in terms of data quality. So you mentioned the processes that you have in place, but did you face any challenges, and how did you resolve them?
Yes. So we spent a lot of time on putting good methodologies on data quality. We have even a service that is dealing with that specifically. Mm-hmm. So if you want, I can give you the coordinates of the person that has been organizing that. But again, the most that you rely on factual data, the less you will have interpretation errors by the one who is delivering the data. That's secondly, if you are reusing the data on a multifunctional level, you prevent fraud, because you will not, again, we had a certain component was not taken into account for the, so people were looking, employers were looking for salary components that were not taking into account for the calculation of the contributions, but were taken into account for the calculation of some benefits, okay? And they were trying not to declare these components in the one situation, but in the second situation. Today, we are using the same factual data. So the employees will say, oh, no, you have to declare everything, because otherwise, at the day that we have a problem, a social problem, this component will not be taken into account. So you put by collecting the data once, by collecting data, factual data once, and you're using it, you have a higher level of. We also delivered what I told you. All control programs on data validation are given in open source to the ones who send us information, so that they can apply it before they send the information to us. So that is also a very important thing. People can also access their own data.
I was going to emphasize that. I think that's
so
also
they
quite
can
crucial.
they can check whether the data are correct, and every time that we use the data, we also give the information to the citizen. Because if you don't need, it's not good to have a black box in the back office. If I'm calculating a benefit, I'm asking you the information, and I calculate the benefit on the information you give it to me. But if I'm not asking for your information anymore, I'm getting it from another database because you delivered it some months ago. Okay, it need to be clear what data we used to calculate your benefit. Otherwise, it is not transparent. So the citizen has also moments where he can check. I can show you whole. So we have a portal, a web application, where I can see my whole career. So I can told you about the simulation environment for old age pension. I can apply the calculation of the old age pension based on my career that is known today. So I have an insight in all information, so I can check whether the data are correct. This was not the case 30 years ago, of course. There you need first to have this harmonization of factual data that you are. But that's the situation today. Yeah. In the health sector in Belgium, I can give you a portal. I have access. So the medical examinations are done in hospitals, clinical labs, and so on. I have access to all my data based on the authentication with my electronic identity card. I can have an insight in everything.
Yeah, and obviously Belgium is also subject to GDPR, so that the citizen being able to access their data also plays.
Of course, yes.
Yeah. Thank you so much, Frank. So I haven't managed to ask all of the questions, but I want to reassure the participants that we can answer in writing to any of the remaining questions that haven't been answered. And I can say that one of them is also about any resources or tools that you might want to share with participants who are looking to enhance interoperability in their systems in their countries. So maybe you could think about that, and we can share those in the follow-up emails. Once again, kind of on behalf of all of us, a big thanks for all of that information and knowledge and sort of institutional background that you shared with us. And I'm going to be handing over to Rodrigo Assumpção from ILO for some final closing remarks.
So I have put in the chat the link to my website.
Fantastic.
If you go on this website, you will find reuse and shared services. There you have a lot of links to the things, and you also an overview of all the presentations. So thank you.
Thank you so much. And over to Rodrigo.
Thank you, Valentina. Thank you, Frank, Anita, and Ernesto. It's been a pleasure listening to you. The Belgian Crossroads Bank has long been a favorite case of mine. because it illustrates one of the great examples of something that we've been discussing a lot, which is the national and then afterwards the international data infrastructure. Because it illustrates how it's not just about, you know, collecting the data, but you've got to structure the ways and the governance rules and the processes where and how this data can be used and accessed. And it's really an impressive feat. Another thing that struck me as extremely important for us to pay attention is the number of times Frank has mentioned and the discussions as well, that this is a journey. Frank didn't wake up 30 years ago and envision everything he has told us today. No, he worked tremendously hard and then came here after 30 years of work to tell us about what he built. ICT, especially used in the social context, is always a journey. It's not a destination. And we have this process that needs to be continuously improved and enhanced. And that brings us to exactly why we're here. It's when we were discussing how this dialogue series would happen and how to structure this, it was always important for us not just to showcase fantastic examples like the one we've seen today, or the previous one where we saw about the Karnataka experience, but especially show that if you start this journey, if you engage in this journey of harnessing ICT, harnessing the service delivery processes, harnessing the data infrastructure, then you will be in a position, perhaps not in 30 years, perhaps more, perhaps much less, because leapfrogging is also one of the most fantastic elements of technological adoption. And when we start this journey, we will improve our knowledge, our understanding, and our capacity to apply all this. And also, as was mentioned by Frank, it's not about what the institutions can do for the technology, but what the technology can do for the institutions. How to structure this and to dominate and apply the technology to your needs, to your citizens' needs, to the needs of what we all hope to reach across most countries, which is the basic idea of universal social protection. And once we go there, then we will certainly enhance this idea and move on further to become more structured, better, more efficient, better able to reach all of us. So it's with great pleasure that I would like to invite everybody not only to keep engaging with us in this series, but also in other series that we are structuring. For example, this Thursday, we are going to have hopefully also a very interesting debate on the first principles of development of digital application, digital transformation within the social protection context. So we have a webinar on Thursday, the 28th, also at 2 o'clock. And I hope you can join. I see that Madhumita has put in the chat the link where everybody can enroll. So with that, I would like to thank all the participants and everybody who was involved in the organization of this excellent experience, and hope that you all engage further with the expectation of applying everything that we've discussed here and every insight that you gathered by watching all of this to your work and to extending our compromise with social protection for all. So thank you very much.
Bye-bye.
Bye.
Bye.